All right, we're going to take our next question from the studio audience. And the question, we will begin with State Senator Rice. And Lori from Tulsa asks, given the current economic crisis, can you please address your party's plans for health care? Obviously, money's going to be tight in this next election cycle for the next 4 to 6 years. How's that going to play into health care? What would you like to see be done?
Well, as I mentioned before, what the issue here is to understand that we already are paying for health care in this country in a way that's bankrupting the economy. And I'll give you an example. My wife is a physician. My wife diagnoses cancer at a community hospital in Oklahoma City. Many of the patients that come through that hospital do not have health insurance. They don't go to see a doctor on a regular basis like a lot of Oklahomans are not able to do. So they get very, very sick and they go into the emergency room or the clinic, and then they have to get diagnosed by my wife, and she's often diagnosing those illnesses when they're in very acute, terrible stages of the illness. They get treated at that stage. It's much more expensive, it's much harder to cure this person, and we all end up paying for that. The taxpayers absorb those costs, those lost costs for the hospital. So it's in our interest, economically and morally, to find a way to work together as Oklahomans, to come together as business leaders and individuals and the state government and the federal government, and this is what they're doing in a lot of states in a bipartisan way, and to have this shared sacrifice plan to where we are able to bring premiums down and enable employers to help pay for less expensive premiums for their employees, and people can have that security of having that basic health care plan and going to the doctor when they're sick.
Senator Inhofe, about 40% of the federal budget goes to things like health care and Social Security and Medicare and Medicaid. Obviously, with this $700 billion bailout, there's going to have to be some cuts somewhere. What do you think is going to happen in health care?
Well, first of all, I don't think it's going to come out of health care. Let's keep in mind, though, Russ, I opposed this thing to start with. If you want to do something about health care, there are a few things that can be done. Andrew mentioned that his wife is a doctor. 3 of my kids are doctors, too, so I get this at home. One of the only thing I can think of right now that is not competitive is health care delivery services. There's no competition there. Health savings accounts would be a tremendous help. That's a great start. And then, as I mentioned before, medical malpractice. The trial lawyers, though, have a lot of power, and that's going to have to change before it's going to take public pressure to bring about medical malpractice.
All right, State Senator Rice, 30 more seconds.
There's no way right now with the system the way it is where the free market and competition can work in healthcare. Like Stephanie Collins' family that I mentioned earlier, they could not go and shop and find another healthcare premium because their daughter had cancer. Pre-existing conditions in these ways that we've let the special interests run our healthcare industry into the ground. We've got to fundamentally change. They can still have a seat at the table and help us deliver the healthcare, but we have to come together as Americans and find an efficient, logical way to make it affordable for everybody, and everybody has to pay a part of it. It's not free.